3, 34, and today 27 with 112 to be determined. That gives us a community transmission positivity rate to the volume of tests taken of 0.3, 0.3, 0.2, 1.6, and 1.1 today with 112 to be determined. The effective reproduction rate looks at all cases and is approximately 4.5. The effective reproduction rate is important for understanding potential hospitalisations. While today's case numbers can be explained, I think we all understand the importance of New Year's Eve to many people, they are concerning. COVID is often an exponential problem. One positive case in the community usually sees more than one person infected. Our community transmission rate, positivity rate, has been sitting below 1. Yesterday and today has jumped well above 1. To maintain our caseload where we can manage it within our health system, we need to keep our case numbers steady. We have a number of mitigations to control spread. The most important remains the testing of interstate arrivals. The PCR positivity rate today is 7%. If we presume all rats are confirmed by PCR, our positivity rate is around 10%. We are catching these cases early. This testing remains crucial to controlling incursions and community transmission. The mask mandate has been in effect since Friday. While masks reduce the risk of spread, the mandate needs to be supplemented. That is why today we've made 3 further decisions to control community transmission in the Territory. There will be a territory-wide lockout from 1 p.m. today until noon Monday. From noon Monday, we will commence a vaccine pass system in the Territory. Also, only residents and essential workers may enter excluded communities in the Northern Territory, and they must have a negative RAT on the day of entry. I will now go through each of these decisions. First, the lockout. The fully vaccinated can continue as they were. For people who are not vaccinated, lockdown rules will apply to everyone 16 and above. If you are not fully vaxxed, stay home. You are at greater risk of catching COVID, becoming ill, and needing hospital care. You may only leave home for 3 reasons. Medical treatment, including COVID testing or vaccination. For essential goods and services like groceries, power tokens, medications. To provide care and support to a family member or person who cannot support themselves. You cannot travel more than 30 kilometres from your home when leaving for one of the 3 reasons, or the nearest practical destination. If you need to go to the hospital and it's more than 30 kilometres from your home, that's okay. There are only 3 reasons to leave the home now, not 5. Work is not a reason to leave the home for the unvaccinated. The Chief Health Officer has also determined that restriction of movement is critical right now, and that 1 hour of exercise for the next 4 days is not essential. Remember, these restrictions only apply to those who are not fully vaccinated. There has been plenty of time for people to get vaccinated. People who are not fully vaccinated present the greatest risk of spreading the virus and are the most at risk of becoming seriously ill if they get the virus. The fully vaccinated are free to continue to go about their lives as long as they comply with the territory-wide mask mandate. The mask mandate remains as is. I'm now going to discuss the vaccine pass. This is not radical. Other states have already brought it in. It is your territory check-in app. The vast majority of Territorians already have their vaccine pass. We're doing this early as a sustainable measure that provides the best ability to control community transmission and who ends up in our hospitals. We know that at home and in a hospitality setting are the 2 highest risk locations for catching COVID. We know that the unvaccinated are at greater risk of needing acute clinical care if they catch COVID. That is why a vaccine pass will be necessary for entering high-risk hospitality settings. Those settings are pubs and clubs, casinos, restaurants, cinemas, ticketed events for over 500 people in urban centres and over 100 in non-urban centres. To enter one of these venues, you must show proof of vaccination. The Territory Check-In app is set up for this. When you check in at one of these events, the Territory check-in app will give you the big green tick and in you go. You can also show your Medicare vaccination certificate, either hard copy or digital. We love our licensed venues. Territorians love having a beer with their mates, and the overwhelming majority get to keep doing this. We want you to be as safe as possible while having a frothy or a feed. We want the vaccine pass to be easy for venues to implement. If you run a venue, you'll be required to ask people to show proof of their vaccination and take reasonable steps if they do not. But the responsibility sits with the individual to do the right thing. I know there are unvaccinated people who can be impolite. I've experienced that. I do not want our hard frontline workers to experience that. If there are troublemakers who try to breach this direction, call the police. The Commissioner will discuss this further. We have a draft direction. We will circulate that today. Mr. Drapsch, the CEO for Industry, Tourism and Trade, will have lead on working with stakeholders on the practicalities of implementation of this vaccine pass before noon Monday. Finally today, I want to reassure Territorians. While the reapplication rate is faster than I want to see at the moment, we can flatten that curve. We have done that before and we will do it now. We currently have a mix of Delta and Omicron in the Territory. Evidence is mounting that Omicron results in less hospitalisations. We are assuming half of Delta at the moment for decision making, but it's growing more evident from the experience down south that this is a conservative assumption and is more likely a quarter of Delta. We are at a point of transition between Delta and Omicron. Our priority is to keep community transmission low and our hospital caseload manageable. Our frontline is amazing. They've been extraordinary for 2 years. The best thing you can do for them, for yourself, for your family, is get vaccinated, get boosted, wear a mask, wash your hands, check in, get tested for symptoms, any symptoms. We're not turning anyone away. If you need a test, we will give you one. Knowing early, acting quickly, that is how we stay on top of this. Thank you.